Dental Office Emergency Case Study Project by Ashley D'Alessandro with the help of Brooklyn. Patient arrives early for appointment and waits patiently in the reception room. His vitals show a slightly elevated BP. The hygienist proceeds to clean the patient's teeth and the patient experiences heart failure. After waiting patiently in the reception room, the hygienist brings the patient back. They begin by reviewing the patient's health history. A comprehensive review of the patient's medical and dental history is the first step in preventing dental office emergencies. The hygienist proceeds to take the pulse and respiration rate and documents them in the chart. After taking the patient's blood pressure, the hygienist notes a slightly elevated BP but decides to continue with the appointment. While scaling the patient's teeth, the hygienist notices the patient is experiencing diaphoresis and dyspnea. She stopped all dental treatment immediately and placed the patient in an upright position, removing all tight clothing. She takes the vitals and continues to monitor them. Oxygen is administered at a flow rate of 3 to 5 liters per minute via nasal cannula. The patient's symptoms are not improving, so the hygienist calls 911. Heart failure is a clinical syndrome that occurs when the heart muscle becomes impaired and no longer effectively pumps sufficient volumes of oxygenated blood to the body's tissues and organs. Heart failure is categorized in 4 stages: A, B, C, and D. In stage A, you are considered pre-heart failure. You are high risk for developing heart failure because you have a family history of heart failure or medical conditions such as hypertension, diabetes, coronary artery disease, or history of alcohol abuse. In stage B, you are still considered pre-heart failure. A healthcare provider has given you a diagnosis of systolic left ventricular dysfunction, but you have never had symptoms of heart failure. In stage C, you have a heart failure diagnosis. You have or previously had symptoms of the condition. Stage D, you also have a heart failure diagnosis. Advanced symptoms that do not get better with treatment. This is the final stage of heart failure. There are 2 types of heart failure: left ventricular heart failure and right ventricular heart failure. The left-sided is the most common type of heart failure. The heart loses some of its ability to pump blood out to your body after it's been reoxygenated. It's usually caused by coronary artery disease. During right-sided heart failure, the heart loses some of its ability to move oxygen-depleted blood to the lungs to pick up new oxygen. It's most often caused by left-sided heart failure, but can also occur even when the left side of the heart is apparently normal. The 3 cardinal signs of heart failure are dyspnea, edema, and fatigue. The table below shows the signs and symptoms of right heart failure versus left heart failure. While they share some things in common, there are things that help differentiate them from one another. For example, in right heart failure, you will have peripheral edema with pitting, nausea, vomiting, headaches, and insomnia. With left heart failure, you will have dyspnea, pallor, diaphoresis, elevated blood pressure, and rapid thready pulse rate. 2 types of preventive procedures for heart failure are lifestyle changes and drug therapy. Some examples of lifestyle changes are smoking cessation, exercise, weight loss, diet and low fat, diet and low sodium, stress reduction, and to limit caffeine and alcohol consumption. Some examples of drug therapy are angiotensin converting enzyme inhibitors, digoxin, diuretics, vasodilators, and beta blockers are used for the treatment of systolic failure. Beta blockers and calcium channel blockers are often used when the dysfunction is secondary to ischemic heart disease or hypertension. The use of local anesthetics containing epinephrine should be considered carefully when treating patients with heart failure. If your patient is experiencing heart failure, it's important to recognize the signs and symptoms. Stop all dental treatment immediately. Place the patient in an upright or semi-supine position. Open all airways and remove any tight clothing. Supplemental oxygen at a flow rate of 3 to 5 liters per minute can be administered via nasal cannula. Continue to monitor the vitals. Try and keep the patient calm. And call EMS if symptoms and the patient do not improve. Alright guys, so that's it for my dental office emergency case study project. I hope you enjoyed.
Thanks for watching my video today, guys.